So welcome everyone. Thank you for joining us today for our Women's Veterans Town Hall this evening. It's March the 4th, and I'm very pleased to say that we have a full program for you. This is, although recorded, there will be chance and ways for you to ask questions, put questions, and get back to us through our PA, or if necessary, get in touch with our Women's Veterans Program Office and Program Manager. So without further ado, I'm going to ask our Program Manager to come and say a few words. Ms. Fritz.
Hello everybody, my name is Brenda Fritz. I am the Hines Women Veteran Program Manager. Today we have excellent presentations from many of our services that are here for our women. We have initially starting here our Women Veteran Medical Director, Dr. Kalapala. She will go over our cervical screening, which is so very important today for our women. Next, we will have Miss Rebecca Kelly. She is one of our dietitians here, and she is going to talk about fiber. Our mental health is very strong here at Hines, and we are excited to have Dr. Rodriguez Cabezos and Dr. Colangelo today present on what Hines has to offer. Next, Lori Luscre will present on health promotion and disease prevention. And then we will go to My Healthy Vet. There are many changes with My Healthy Vet, so the information here will be for reference, and you can update yourself with our new My Healthy Vet. Our last presentation today is going to round out with aromatherapy for veterans. And I can tell you that many of our veterans have already been able to participate in aromatherapy and have fully appreciated and enjoyed this. One thing that I want to say before I leave is that VA is for all women. And at Hines, we have a very safe setting, trustful, and just for you. So please, the phone number's here. You can reach out to us. And also, our phone number for Hines is also available. Next, we're going to have our Women Veteran Medical Director, Dr. Kalapala.
Good afternoon. Once again, welcome to Women Only Town Hall meeting. I'm going to briefly talk about cervical cancer and the screening for cervical cancer. These are the outlines. What is cervical cancer? Next is what is the incidence of cervical cancer and what are the symptoms, what are the causes, risk factors for cervical cancer, and what are guidelines for screening and when to start screening. Let's go to the next slide. So cervical cancer is the cancer of the cervix, which is the lower part of the uterus. About 12,000 women are diagnosed with this cancer, and it is the third to fourth most common gynecological cancer in women. Average age of onset is about 52. You see in this picture human papillomavirus, and that can infect the lower part of the cervix, and that causes cancer. So some of the causes of cervical cancer. As I mentioned earlier, human papillomavirus are the large group of viruses, and about 40 of them can infect the human genital tract, and they cause the cervical cancer and genital warts. Out of those, human papillomavirus 16 and 18 have the highest risk. Most of these genital human papillomavirus infections will go away on their own, and some become chronic and they cause precancerous changes in the cervix. And out of the 90% of cervical cancers are caused by human papillomavirus. Next, we're going to talk a little bit about the risk factors. Once again, human papillomavirus. Next one is immune system deficiencies like HIV infection or other immunosuppression, cancer treatments, Next is multiple sexual partners and having intimacy with your partner at an early age. Next is sexually transmitted diseases like chlamydia infection, gonorrhea infection, syphilis, herpes infection, HIV infection, tobacco abuse, and exposure to a drug named diethylstilbestrol, and inadequate cervical cancer screening. 1 in 4 eligible women in the United States are not up to date with their cervical cancer screening, and out of 60% of cervical cancers, they occur in underscreened women and also with human papillomavirus infection. What are the symptoms? At very early stages, there are no symptoms at all, and as the cancer grows, women can have abnormal vaginal bleeding. This bleeding can occur in between periods and also during intimacy with their partner or after menopause. So periods can be heavy and painful. They can have abnormal pelvic pain. They can have discharge, like a pale discharge, watery discharge. Next, what do we do for screening for cervical cancer? There are two tests available. One is HPV testing. This test mainly looks for virus that causes the precancerous changes in the cervix. Next is a Pap test. Pap test looks for cells which are abnormal and precancerous in the cervix. Please pardon my typos here. Next is a combined test, this test combines both HPV test and Pap test. No matter what test we use, regular screening is important. Screening helps to detect the cervical cancer and the precancerous cells that may one day become cervical cancer. Okay, at what age do we begin? Pap screenings are usually started at the age of 21. Women between ages 21 to 30 are screened every 3 years if their previous tests are normal. Women between 30 to 65 are screened either at 3 years with Pap test alone or every 5 years with a combined test. Frequency of these screenings may change if your previous tests are abnormal. When to stop screening? Women are advised to stop screening at the age of 65, provided if they had normal tests last 10 years, and also if they did not have any serious diagnosis like CI and II in the past 25 years. Women who had hysterectomy for a benign condition no longer have cervix, so they don't need this Pap test. Next, women who had total hysterectomy have cervix, and they still needs to be screened. Prevention. As we all know, prevention is better than cure, and cervical cancer screening cancer can be prevented by HPV vaccination to some extent. Regular Pap smears detect the precancerous cells, and quitting tobacco. Our next presenter is Rebecca Kelly, but I'm going to end this presentation with one thing. At Hines VA, there are several PCPs who are well trained with these screenings. Kindly please reach out to them and get your screenings done. Thank you.
Hello everyone. As mentioned, I'm Rebecca Kelly. I am an outpatient dietitian in the PACT clinic. I'm going to be talking about fiber today. Fiber is a substance that we find in plants, and it is important for both our health and for our digestion. We have two different types of fiber, broken down into soluble fiber and insoluble fiber. Our soluble fiber will aid with slowing down digestion, has potential to lower cholesterol and reduces the risk of heart disease, can help stabilize blood sugar levels, and does stimulate growth of good gut bacteria, where our insoluble fiber adds bulk to stool and can help prevent constipation, and it reduces the risk for colon cancer. Some food sources of both our soluble and insoluble. For our soluble would be things like whole grains, apples with the skins on. For most of your fruit and vegetables, you're going to want to leave the skin on to get the most amount of fiber out of each food source. Soluble fiber also includes flax seeds and psyllium seeds or psyllium husk. And then our insoluble fiber are things like pears, raspberries, avocados, corn, quinoa. It's important to note that a lot of our food sources, both fruit, vegetables, whole grains, contain a variation of both types of fiber. So a lot of foods you can kind of get more bang for your buck and get both sources in just one food item. How much fiber do I need? It's going to vary based on a couple different things, but generally, persons under 50 years of age, 25 to 38 grams per day. Persons over 50 years of age, 21 to 30 grams per day. And if you need to look up or ask your dietitian what your specific fiber recommendations are, you can do that, meeting with a dietitian, or there's a lot of resources online that can give you some guidance per age, and then sex as well, just to kind of know exactly where you should be at. Using our food label is one of the best ways to identify fiber sources in our foods. So we look at the serving size, and then we're going to go down and look at the dietary fiber right under carbohydrates. For something to be considered a high fiber food or to give us some benefit with fiber, it would be around 5 grams or more per serving. So some tips to increase your fiber intake would be leaving the skin on our fruits and vegetables, incorporating whole wheat, whole grain products when able, adding more oatmeal and beans into our diet, including a variety of fruits and vegetables, remembering to increase our fiber intake slowly to avoid GI distress. So it's very important that if we're eating very little fiber in our diet, that we add one high fiber food, more or less about a week eating that high fiber food, and then on that second week increasing to 2, while also increasing our water intake. That is going to give us the best defense against things like cramping, bloating, and gas. And then you want to aim to get your fiber from food sources first and supplements second. So Metamucil, Benefiber, some of our other fiber gummies, those are still great ways to get in our fiber, but we know that our body loves food first and is able to better utilize food items that contain fiber versus kind of using some of those supplemental sources. How do you discuss fiber or any other nutrition concern? You can meet with a dietitian here at Hines. You can either have your primary care provider or doctor place a consult, or you're able to just call central scheduling and say, I want to meet with my dietitian, and you're able to get scheduled without a consult or referral. We are considered a low-risk clinic, so that meaning you're able to kind of schedule it as you like and when you'd like. And we go over pretty much everything under the sun, so reach out to your dietitian to discuss some nutrition concerns. For our next presenter, we have Dr. Rodriguez Cabezas and Dr. Colangelo talking about mental health.
Hi, good evening, and thank you so much for joining us. March is Endometriosis Awareness Month, and so we wanted to take some time to give you some information about what endometriosis is and how we might be able to help you in mental health specifically. So endometriosis is a condition where tissues that are similar to the inner lining of the uterus grow outside of the uterus and on other parts of the body where they do not belong. And this can cause inflammation, pain, and sometimes irregular bleeding. And here are a few things that are important to know about that. About 1 in 10 women of reproductive ages may experience endometriosis, and despite this being common, it often takes years to diagnose due to a lack of symptom awareness. Some of these symptoms may include severe pelvic or abdominal pain during your period, while having sex, or during bowel movements that are not normal. If over-the-counter pain medications don't help and this pain disrupts everyday tasks for several months, it may be time to talk and ask your providers for help. Endometriosis can also make it difficult to get pregnant. Between about 30 to 50% of people who experience endometriosis may struggle with infertility challenges. Early diagnosis really matters. If left untreated, these pain and symptoms can get worse. And so it's very important to talk to your VA healthcare providers about your symptoms and your concerns. Because if left untreated, endometriosis can become a chronic health condition. Experiencing endometriosis can understandably be challenging and cause distress, and it may lead to things like experiencing depression or anxiety. And we understand that this important connection between your reproductive health and your mental health, which is why we offer our clinical services. And Dr. Rodriguez is now going to talk to you a little bit about that intersection between our reproductive health clinical team. Oops, there's my lovely slide that I forgot. It's very pretty and yellow.
Thank you for that introduction, Dr. Colangelo. As she mentioned, I'll be talking about our Reproductive Women's Mental Health Clinic and what services we provide for mental health related concerns that women might have. So we address reproductive health across the lifespan for all women. So some examples of some conditions that we specialize in treating are infertility, preconception planning, premenstrual mood exacerbations, so things like premenstrual dysphoric disorder, perinatal mental health, questions about contraceptive use and the related psychiatric or psychotropic medications, reproductive trauma, gynecological comorbidities, which, as she mentioned, an example would be endometriosis and the distress that women may experience as a result of that, perimenopausal mood disruption, female reproductive systems cancer, and sexual health just in general, along with postpartum related mood issues, mood and anxiety issues. So what are the types of services that we offer? So we offer reproductive women's mental health psychiatric services, which involves a consultation with a psychiatrist. When we receive a consult, we do a thorough chart review before meeting with the veteran. We do a full evaluation with the veteran themselves. That could be in person or it could be virtual, depending on what the veteran's needs are. We make recommendations tailored to the veteran based on her history, based on the previous care she's received, and according to what her concerns are at that visit. We also make those recommendations to the referring clinician. So let's say that they are already receiving care from someone and they want to continue receiving that care from their trusted clinician. What we would do is see that veteran and make recommendations both to the veteran themselves and also to their clinician so they can continue to work together and feel like they still receive the expertise that our clinic can provide. We also offer ongoing care. So let's say they're not connected with any clinician, they need to have ongoing care. Then we would go ahead and continue to manage that veteran's care by providing medication management. For example, during pregnancy, postpartum, breastfeeding, during their perimenopausal or premenstrual related symptoms, we would do kind of the broad spectrum of treatment. If they wanted to receive therapy services, we also offer that. So we offer a wide variety of different types of individual therapies. You can see kind of them listed out there, but they basically treat depression, anxiety, post-traumatic stress disorder type symptoms, insomnia, and a variety of others. We also offer group therapy. So the two options listed here is ROSE, which stands for Reach Out, Stay Strong, which is a 4-session support group to prevent postpartum depression. And we also offer a women's MST group, which is a 6-month blended skills and support group to promote recovery from trauma. We also offer couples therapy, which helps to support women and their women veterans and their partners navigating challenging relationship dynamics associated with reproductive health events. We hope that you will either ask your clinicians if you're already linked with care for a referral if you have any concerns related to these reproductive specific issues, or that you self-refer to mental health intake and then you can get referred to our program. I'm going to introduce Lori Luscre next from Health Promotion Disease Prevention.
Good evening, everyone. I am here with some updates from Health Promotion Disease Prevention. I want to follow up a little bit on the cervical cancer screening information we had earlier today, and just with a broad general recommendation so that folks are reminded to get your recommended screening tests and immunizations. Screening tests are used to find health conditions before there are symptoms. Recommendations are based on age, family history of disease, and your lifestyle, which could include things such as tobacco use or alcohol use. Vaccines are helpful to prevent disease, both for you and those around you. So remember, when we're getting vaccinated, we aren't just protecting ourselves, we're protecting our loved ones, our coworkers, our friends, our family, everyone that we're interacting with. Recommendations for vaccinations range from annual vaccinations or booster sets on certain schedules or one-time single doses. You can find more information on screening tests and immunizations at prevention.va.gov, and you can talk to your healthcare team to make sure that you're up to date on all of your screening tests and immunizations. And I do want to take some time to specifically talk about the flu shot and COVID-19 vaccinations. It's not too late to vaccinate. Seasonal flu activity remains elevated. This season has been classified as a high severity flu season for all age groups, and this is the first one since 2017 and 2018 season. COVID-19 and flu vaccines continue to be available at Hines and our CBOCs during regular clinic hours, and no appointment is necessary. The locations at Hines are on the screen, and again at any CBOC. You can also get them through the Community Care Network, and the website is va.gov/communitycare/flushot.asp to get details on where you can get your flu shot and COVID-19 shots at no cost. The last thing I want to promote today is a new program that we have available to all veterans. It is our Peer Wellness Workshop. Wellness Workshop is a program that we have been providing through Health Promotion Disease Prevention for many years. Now we have a special session that is led by one of our peer support specialists, Jessie Guerrero. Every first and third Monday from 10 to 11 in Building 228, Room 3027, Jessie will be teaching topics including managing stress, sleep, and make a health change. There's a total of 8 topics, and you can come as many times as you like. You don't have to come in any specific order, and you don't even need to make an appointment or sign up to come. If you'd like more information, you can call Jessie at 708-979-0748, or again, walk in any first and third Monday at 10 o'clock to see what Wellness Workshop is all about. We'll also put some flyers in the Women's Health Clinic here at Hines too. Next, I'm going to introduce Philip Walton, our My Healthy Vet Coordinator.
Thank you, Lori. Good evening, everyone. Again, my name is Philip Walton, and I'm the My Healthy Vet Coordinator here at the Edward Hines Junior VA Hospital. I want to just give you a brief summary about the My Healthy Vet program, some of the changes with My Healthy Vet program, and give you some contact information in case you have any questions. So, what is My Healthy Vet? My Healthy Vet is VA's private and secure online personal health record for veterans, active duty service members, their dependents, caregivers, and its online resources and tool offers veterans a greater control over their health care and wellness. I also like to share with you CHAMP VA recipients and VA employees can also register for a My Healthy Vet account. So the benefits of having a My Healthy Vet account. Veterans and users can manage their pharmacy needs, which they can submit refills for their prescriptions. They can track the delivery, view a list of their prescriptions and other details as far as medications. They also can view, print, and download information from your VA medical records. One of the benefits and services that veterans do enjoy, communicating with their doctors. They can communicate securely online with their VA healthcare team and other VA staff about non-emergent information or questions. Also, veterans can manage their upcoming VA medical appointments and get email reminders. VA patients with a premium account can schedule and cancel VA appointments at participating facilities. I also like to brief you on a couple changes that's taken place. My Healthy Vet is moving its home to va.gov, but don't worry, My Healthy Vet health portal isn't going away. Users just need to sign into their My Healthy Vet accounts and online sites through login.gov and id.me accounts. With this change, My Healthy Vet users will have an easier, secure, convenient, and more modern sign-in experience. To register, users need to use their personal email address and create a unique password, and set up a multi-factor authentication for their account as a requirement for both login.gov and ID.me. Another update that I would like to share with you: on Wednesday evening, March 5th, the My Healthy Vet button will be removed from va.gov sign-in pages on My VA Health, also on va.gov, VA Web, mobile apps, and My Healthy Vet. With the Wednesday changes and the release, the My Healthy Vet sign-in page will be redirected to the va.gov sign-in page. All active My Healthy Vet accounts that have a My Healthy Vet user ID and password will then be disabled. Also, the following day, on Thursday evening, March 6th, the My Healthy Vet credential will be removed from all apps on Access VA websites. And just give you an illustration of what the login page will look like. On the left of the screen, you'll have the sign-in as it currently is now, and then on the right of the screen, the sign-in after March 5th. Again, DS Login will retire its user credentials on September 30th, and again, as I stated early in the presentation, My Healthy Vet will retire its username and password credentials on March 4th. So if you have any questions or would like to register for a My Healthy Vet account, login.gov or ID.me, or you need assistance, please, you can contact our office. It's 708-202-5633. Again, that phone number is 708-202-5633. You also can visit our office. We're located in Building 1, room F140 at the Hines campus. Next, I would like to introduce you to Elizabeth Rojas Serna and Miss Jennifer Maloney give you an update on aromatherapy.
Hello everyone, my name is Elizabeth Rojas Serna. I work on 9 West.
And I'm Jennifer Maloney. I work in surgical ICU here at Hines.
So for those of you that aren't familiar with what aromatherapy is, it's using natural essential oils derived from plants as a non-pharmacological approach to enhance the veteran experience. It's used as a complementary treatment for clinical symptom management, which may relieve discomfort by reducing nausea, decreasing pain, promoting relaxation and comfort.
Here at Hines, we are going to be using Eloquil aroma tabs. We have lavender peppermint, which lasts up to 8 hours. It helps patient to relax when in pain, promotes comfort, decreases anxiety, and lower chances of nausea. We have lavender sandalwood, which lasts up to 24 hours, and that also helps to relax when in pain, promotes comfort, and decrease anxiety. We have lavender, which lasts 8 hours, and it also does the same. And then we have orange peppermint and orange ginger, which both last up to 8 hours, and they decrease queasiness and help uplift.
So the Eloquil aroma tabs, we actually have a policy already in place for staff to use, and it's been approved for use throughout the hospital and the CBOC clinics.
Indications for aromatherapy. Veterans who subjectively report or have signs and symptoms of pain, nausea, and or vomiting, anxiety, insomnia, end of life, will be provided the option to use aromatherapy to actively or passively inhale. This initiative is nurse-driven and evidence-based. No physician order is needed.
So some contraindications for the aromatherapy include veterans with a current history of a reactive airway, any perfume sensitivities, or allergies to lavender, peppermint, spearmint, ginger, or sandalwood essential oils. And the peppermint oil specifically is contraindicated for patients with cardiac fibrillation and G6PD deficiency.
And if reaction is observed, take off the patch. Discontinue the use immediately, ventilate the veteran's immediate environment, monitor for further respiratory distress, and notify a provider. If there's any eye exposure, make sure to wash the eye by normal first aid methods, and if there's skin exposure, just wash with basic soap and water, and if ingested, seek a physician.
So the good thing about these little packages is there's no spills or leaks. It can be held below the nose and continuously inhaled or used passively whenever the veteran is experiencing any negative clinical symptoms. It's intended for placement on clothing. No undiluted oil is meant to touch the skin or any mucous membranes, and the veteran can use it throughout the course of their stay and take it with them upon discharge or after their clinic appointment. Each aromatherapy tab is intended for single patient use only and can be simply discarded in a regular trash receptacle once done.
And if you have any questions or concerns, you can reach out to either one of us.
Thank you.
Thank you.
I hope that you found this information very useful. On the screen, you have our phone numbers for Edward Hines VA Hospital. Please reach out, utilize these phone numbers, and participate in some of these wonderful programs that we have for our veterans. Thank you.